310,000 Pennsylvanians risk losing Medicaid under new federal cuts. Imagine a scenario where hundreds of thousands of Americans could suddenly find themselves without vital health coverage. That's exactly what's at stake with President Trump's proposed, One Big Beautiful Bill, which could strip 310,000 Pennsylvanians of their Medicaid benefits in the coming decade. But here's where it gets controversial. The bill aims to cut over $1 trillion from federal health care programs, including Medicaid, and introduce stringent work requirements that could leave millions struggling to keep their coverage. You might be surprised to learn that your health plan could be part of Medicaid, even if it's branded differently. Many Americans are unaware that their state-specific health programs, such as Husky Health in Connecticut, Sooner Care in Oklahoma, Badger Care Plus in Wisconsin, Green Mountain Care in Vermont, and Dr. Dinosaur in Vermont, are actually funded through federal Medicaid dollars. This rebranding was intended to reduce stigma and make these programs seem more like regular health insurance. However, it has inadvertently created confusion among beneficiaries. In Pennsylvania alone, approximately 2.8 million people are enrolled in medical assistance, the state's combined Medicaid and CHIP program. Yet, only about 71 million out of the 78.5 million people officially recorded as Medicaid beneficiaries in 2023 self-reported having coverage. This discrepancy, known as the Medicaid undercount, highlights how many individuals are unaware they are enrolled in Medicaid. The situation is further complicated by the fact that most Medicaid recipients receive care through private managed care organizations, not directly from their state government. This adds another layer of complexity for beneficiaries, who may interact more frequently with these private companies than with their state agencies. As a result, many patients are unsure whether their insurance is publicly funded through Medicaid or privately provided. Under the proposed bill, adults aged 19 to 64 would need to verify twice a year that they are working 80 hours a month, attending school, or participating in community service. While supporters argue that these requirements aim to reduce waste, fraud, and abuse, critics contend that they disproportionately affect vulnerable populations who already struggle with financial instability and access to resources. In states that have already implemented similar work requirements, such as Arkansas, thousands of people lost their coverage without seeing significant improvements in employment rates. This suggests that the new federal mandates could lead to widespread disenrollment without achieving their stated goals. The implications of these cuts extend beyond individual beneficiaries. Medicaid is the largest health program in the United States, providing essential coverage to low-income individuals, people with disabilities, pregnant women, and seniors. Cuts to Medicaid could strain state budgets and threaten the sustainability of rural hospitals and clinics that rely heavily on Medicaid funding. As these changes unfold, it's crucial for policymakers and stakeholders to consider the broader impact on public health and social welfare. The coming years will reveal whether the One Big Beautiful Bill truly achieves its objectives or inadvertently exacerbates existing inequalities in access to health care. So, what do you think? Should these work requirements be implemented, or is there a better way to address concerns about waste and fraud in Medicaid? Share your thoughts in the comments below. The Hidden Struggles of Medicaid Beneficiaries, a Personal Story. Is cheating the system the only way some people can survive? This is the painful reality for many Americans struggling to stay afloat, and it's a debate that gets more heated every year. But here's where it gets controversial. Are people on Medicaid actually gaming the system, or is the system itself setting hard-working individuals up for failure? Let's look at James' story from Missoula, Montana, a tale that cuts straight to the heart of this issue. For James, Medicaid and the prescriptions it covers aren't just benefits, they're his lifeline. Without them, he says, he couldn't hold down his sandwich shop job, which became possible only after entering an addiction recovery program. Despite his dedication at work, where his boss repeatedly compliments his performance, a small hourly raise threatens to unravel all his progress. James, who prefers to keep his last name private to avoid losing coverage or facing accusations of fraud, finds himself facing an agonizing dilemma. The raise, amounting to about $1 more per hour, now pushes his annual income just over the Medicaid eligibility line by roughly $50 a week, about $21,000 a year. Suddenly, He's caught in a bureaucratic chokehold, earning enough to lose support but not nearly enough to comfortably cover his living expenses, medications, and health insurance. Does this justify his choice to fudge the numbers? James confesses he hasn't reported his new income to state authorities. Why? Because after accounting for rent, car maintenance, and a phone bill, there's simply not enough left for health insurance. Even the most affordable options under the Affordable Care Act or his workplace health plan leave his bills, like the $60 a month just for sleep medication, out of reach. I felt like I had no choice, James admits. Fudging the numbers was the only way I could keep my medicine and keep working. And this is the part most people miss. People like James aren't the so-called freeloaders politicians love to talk about. Still, recent policies, like new Medicaid work requirements rolled out in President Trump's budget, are fueled by the narrative that the program is rife with fraudsters lounging on government handouts. Critics, including House Speaker Mike Johnson, claim such rules weed out waste, fraud, and abuse. But research repeatedly shows actual fraud among enrollees is rare. In reality, complexities and confusion around Medicaid eligibility mean that millions of people who desperately need coverage aren't getting it. As of 2023, well over half of Medicaid recipients were already working, according to studies by KFF, a leading nonprofit dedicated to health policy research. The real problem? People working hard to leave hardship behind, like James, hit what experts call the benefits cliff. Just when they get a modest raise or secure a few extra hours, they suddenly lose support. Alternatives, like ACA marketplace plans, can leave sizable gaps in care or come with costs still out of reach for low-wage workers. So they face an impossible choice: fudge income reports, cut back work hours, or go without medical care. James, who considers himself patriotic, doesn't think people should take advantage of government programs. I believe if you can work, you should, he emphasizes. Still, the system now forces him to hide the very work ethic policymakers say they want. I don't want to be a fraud. But I don't want to die either, James says. Those shouldn't be my only options. Recently, federal law has made retaining Medicaid even harder for working adults, increasing paperwork and demanding proof of work or school every 6 months. Opponents, including Harvard health economist Ben Summers, warn that these changes punish exactly the people Medicaid was designed to help: low-income Americans juggling unpredictable work and mounting chronic health needs. Truth is, most Medicaid recipients are not abusing the system, they're barely hanging on, Summers notes. James already knows firsthand how easy it is to get dropped from Medicaid. In the past, he'd lost coverage just a few weeks into his recovery when he first started working. Desperate to stay in treatment, he intentionally reduced work hours until he requalified, only to find himself stuck in a cycle of uncertainty: risk losing coverage by working more, or forfeit a shot at saving up for a better future. They'll toss you a bone if you stay in the mud, James says. But you have to stay there. This catch-22 isn't just James' problem, it's widespread. It's officially called the benefits cliff. Pamela Hurd, a University of Michigan public policy researcher, points out it makes no sense that a minimal raise can instantly wipe out crucial health coverage. Hurd points to continuous eligibility as a partial fix, which would guarantee Medicaid for a set period, giving people a chance to adjust their finances. But recent federal policies have moved away from this, instead narrowing eligibility review windows and tightening rules, likely driving more people off the cliff. It's going to be a nightmare, Hurd warns. And for those with chronic conditions, like James, the stakes are even higher. Just last year, James wouldn't have broken any rules. Montana previously allowed 12-month continuous Medicaid coverage. But a new law now requires income changes to be reported in just 10 days, adding yet another layer of anxiety for those already struggling. The progress James has made is remarkable. Only a year ago, addiction had ravaged his health. His hands shook too badly to hold a spoon, alcohol withdrawal caused seizures, and he survived on flashes of fear, paramedics, ambulance lights, a landlord's worried face. He has since completed treatment, is taking classes to become a licensed addiction counselor, and dreams of lifting others out of the darkness he's known. But none of that, he says, is possible without the continued buffer Medicaid provides. Every time James receives a letter in the mail, he braces for devastating news. I'm constantly in fear that I'm going to lose Medicaid. If it goes away, what then? As of mid-July, his unreported income increase had gone unnoticed by state officials. For James, and many in his position, survival and honesty seem painfully at odds. But what do you think? Does the current Medicaid system trap good people in poverty, or is tougher enforcement necessary to weed out abuse? Should individuals like James be blamed for bending the rules, or is the system itself in need of serious repair? Share your thoughts below. Let's talk about whether the safety net is serving its purpose or simply tangling those who need it most. Medicaid work requirements, a devastating blow to healthcare access. The harsh reality of Medicaid work requirements. Imagine a world where access to essential healthcare is determined not by need but by your ability to prove your participation in the workforce. This sobering scenario is at the heart of one of the most controversial aspects of the Republicans' recent legislation, known as the One Big Beautiful Bill Act. Specifically, the act introduces stringent work requirements tied to Medicaid, which affects millions of Americans. For the past 60 years, Medicaid, an affordable healthcare program covering 71 million of the country's most economically disadvantaged citizens, has functioned without imposing any work requirements. Historically, eligibility has been based solely on income and immigration status, allowing those who qualify to gain necessary healthcare coverage. Statistics reveal that most Medicaid recipients are actively engaged in the workforce. Only 8% of adults under the age of 65 in the program were retired, unable to find employment, or otherwise not working. The overwhelming majority, 92%, were found to be employed, serving as caregivers, or were attending school or facing health issues. A ref equals https://www.kff.org/medicaid/issue brief/5 key facts about Medicaid work requirements/KFF/A. However, with the newly passed legislation, adults under the age of 65 who do not have dependents under 14 will face the daunting requirement of proving at least 80 hours of work per month to maintain their Medicaid coverage. This shift brings dire moral implications. Access to critical healthcare services, such as treatment for diabetes, mental health medication, or even the care for a broken wrist, will now hinge on an individual's perceived productivity in the job market. But there's more than just ethics at play. Experts warn that this drastic policy shift could present significant logistical headaches for states tasked with establishing intricate work verification systems. Matt Bruenig, founder of the People's Policy Project, candidly remarked that the implementation of these requirements may well result in chaos when states try to put them into practice. States will need to comply with these work requirements by December 31, 2026, giving them roughly 18 months to create complex verification systems to manage an influx of new regulations. However, states have the option to start sooner through waivers, meaning some might jump on the opportunity without adequate preparation. As Bruenig pointed out, key questions loom over these requirements. How will states verify employment status? Will informal work count towards the required hours? For instance, can Instacart drivers, who often experience significant downtime between orders, consider that idle time as part of their 80-hour tally? What happens to seasonal workers who lose coverage during off-seasons? The challenges become even more pronounced when considering informal labor, such as house cleaning or landscaping. For jobs like these, it's not common to have formal paperwork that can serve as proof of work, Bruenig explained. Beyond just confirming employment, individuals must track and prove that they worked the specified number of hours within the month, a request that seemingly contradicts how informal work operates. In previous attempts at enforcing work requirements on a state level, the results have often been dire. For instance, during the Trump administration, 13 states received waivers to impose work restrictions on Medicaid. Proponents assert that such policies will drive workforce growth and energize the economy. However, Arkansas's previous experience with these requirements tells a different story. After implementing a work requirement in 2018, Arkansas found that many Medicaid recipients were unaware of the changes and were unable to provide the necessary documentation. Compounding the problem, access to an online portal was difficult for those lacking internet access or technological skills, resulting in approximately 18,000 Arkansans losing their Medicaid coverage without any substantial increase in employment numbers. Research indicated little change in work participation. A ref equals https://www.healthaffairs.org/doi/10.1377/healthaff.2020.00538 healthaffairs/a. Ultimately, a court overturned Arkansas's work requirements, and most other states followed suit or ceased their programs when President Biden assumed office. Currently, Georgia stands as the only state still enforcing such requirements. The financial implications of this policy change are also disconcerting for states. A Government Accountability Office (GAO) report in 2019 revealed that Kentucky's proposed work requirement could have led to $271.6 million in administrative costs alone. Like Arkansas, Kentucky's efforts were also blocked in court. In contrast, the new law allocated merely $200 million for all states combined to help manage these expenses, equating to just $4 million for each state on average. These fiscal projections don't consider the broader economic fallout from removing individuals from Medicaid. No one receives a check from Medicaid, the funding goes to pay for healthcare services provided to patients, Walsh noted. Once that money is cut off, it translates to substantial losses, potentially in the hundreds of millions annually for states like mine. In Vermont, Walsh emphasized that the state lacks sufficient budgetary space to compensate for these losses, meaning hospitals may need to absorb the financial shortfall. This could lead to staff layoffs or even closures, especially in rural communities where hospitals serve as pivotal employers. Medicaid is not alone in facing new work requirements. The Supplemental Nutrition Assistance Program, SNAP, is amplifying its existing requirements, mandating that veterans, homeless individuals, those aged 55 to 64, and parents with children over 13 can only receive benefits for a limited 3 months within a 3-year period unless they are employed. After this window closes, assistance disappears altogether. Housing advocates are anxiously watching for similar changes to federal housing programs. Hannah Adams from the National Housing Law Project expressed concern over the possible introduction of work requirements and time limits in crucial programs such as Section 8, which provides crucial housing support for low-income individuals, as well as programs aiding disabled individuals, former foster children, and victims of domestic abuse. As lawmakers draft budgets and introduce new legislation like the Road to Housing Act, Adams noted, "We can't predict exact outcomes, but it appears the aim is to remove assistance from countless families who rely heavily on these programs." The trend of imposing work requirements has considerable appeal for conservatives looking to dismantle social safety net programs such as Medicaid, SNAP, and housing support. Notably, the idea of a bootstrap mentality resonates positively with many voters. Officials like Health and Human Services Secretary RFK Jr., Centers for Medicare and Medicaid Services Administrator Mehmet Oz, Agriculture Secretary Brooke Rollins, and HUD Secretary Scott Turner stated in a New York Times op-ed that a significant 62% of Americans are in favor of such requirements. Yet, when surveyed on the reality that the majority of Medicaid recipients are indeed working and might lose their benefits, that percentage plummets to a mere 32%. A ref equals https://www.kff.org/medicaid/poll findings/KFF health tracking poll public views on potential changes to Medicaid/KFF/a. Nonetheless, Republican narratives regarding work requirements reflect a nostalgic image of America, where blue-collar workers embody a sense of national pride and purpose, free from barriers to finding employment. Unfortunately, the stereotype of welfare freeloaders who supposedly exploit the system is a potent narrative that enables further damage to these programs. As Brunig noted, the conservative movement generally harbors an ideological opposition to these benefits. If ideology were unfettered by the need for political backing, there would be a movement to eliminate such programs entirely. However, in light of the political reality, they opt for cuts instead. What are your thoughts on this controversial topic? Do you believe work requirements will help or hinder those who rely on these social programs? Let's hear your perspective in the comments. ****